I am, oh, I think we're live now.
Okay.
Assalamualaikum. I am Yalda Amadi. I work with Olive Branch Muslim Family Services. Um, Olive Branch Muslim Family Services is a nonprofit here in Houston. Our mission is to strengthen, support, and empower individuals and families through counseling, education, and social services. Assalamualaikum, Azair. Thank you for joining us. So I think we're all here. We're just doing our introductions. As I mentioned, I'm Yalda Ahmedi. I work with Olive Branch Muslim Family Services here in the Houston area, offering social services to the Houston community with a culturally competent lens on the very diverse Muslim Houston community here. Um, and our goal as an organization is to break down the socioeconomic and stigma-related barriers for a lot of families and individuals that struggle to gain access to mental health resources as well as social service resources and education. And I'm joined here by Nahla. Want to introduce yourself?
Sure. My name is Nahla. I am a medical graduate who graduated from Australia, but I am a Canadian living in Canada at the moment. So I'm applying for residency in psychiatry here. I'm not employed yet. I'm not registered here at the moment. So I'm just working on my applications and doing board exams.
And awesome. Congratulations.
Thank you. Uzair.
Oh, great. Yeah, Uzair Rashid. Vocationally right now, I'm a director of innovation at a large payer where our mandate is to sort of generate both incremental and around the bend innovations that align with our strategic imperatives. So, some cool stuff we're working on right now is around behavioral health. Other programs are around reimagining virtual care that has tie-ins to behavioral health as well. And then leading up to Blue Cross, I was heading strategy and innovation at CVS Health, where I was reimagining care delivery and launched a behavioral health program into the market. So it's a topic I'm incredibly passionate about. It's so timely, it's so relevant, and I'm so, I guess the word is passionate and happy to be here. Prior to CVS, I've been a lifetime consultant, both as a managing principal at a large tech consultancy firm, and then I ran a boutique tech consultancy group of my own leading up to that.
I think that's great, the blending of the technology, and now more than ever, we're seeing behavioral health kind of make the steps in that direction, more so out of necessity, but also like it helps with access and individuals like in rural areas, and really just expanding the coverage that we can provide with behavioral health.
Yeah. I couldn't agree more. I think especially in a time of COVID where we're all, agnostic of the acuity of care and sort of the specialty of care, we're all challenged with sort of removing distance as a barrier to delivering high quality care.
Yeah.
Naturally, something like mental health or behavioral health is such a low hanging fruit when it comes to thinking about introducing a digital modality or a sort of a virtual solution in terms of addressing those three things you laid out: access, coordination, and even cost.
Yeah, I think you really hit the nail on the head with mental health is very much so like that low hanging fruit that our community, it's available, it's there, but as far as reaching for it, we don't see that very often. And I think it comes a lot from whether individuals have that immigrant background or not. But kind of going back to like Maslow's hierarchy of needs, right? So at the bottom of that, and the most important, you have your physiological needs like food, water, shelter, and then you go into safety needs, and then you kind of go into that feeling of wanting to belong. Um, and then I feel like our community sometimes stops at the esteem needs, that idea of, okay, we've hit that accomplishment. We should be happy. We should be satisfied. We have that prestige. And then we kind of miss the very top of that pyramid, which is self-actualization. And it's like achieving one's full potential and something that plays along with understanding oneself. And sometimes we miss that, and that's individuals, families, within our communities, um, because all the other needs are met. We forget that top one, and I think that our community tends to tie mental health and behavioral health with kind of like the extremes of it. So when you mentioned behavioral and mental health, to your average individual that just might be going through hard times, they're like, well, I don't need behavioral health. I'm not hearing voices. I'm not seeing, delusions or anything like that. But they are going through a hard time, and they need those resources out there. But they're oftentimes afraid of those labels that sometimes they feel like comes with attempting to get access for that sort of help and need. Yeah.
I think, first of all, very well said and absolutely nail on the head. But if almost like I want to take one step back and think about just like BH as an issue, like period. And if we think about behavioral health, I mean, the facts are clear. Like this is the single largest concomitant associated with someone with a chronic illness, right? So like think about populations that are stricken with diabetes, hypertension, chronic heart failure. More often than not, a comorbidity associated with that disease is a behavioral health issue. And, I might actually mark it as the single largest epidemic in the United States today, or in the world today, really is behavioral health. And then you're hitting something that is sort of causing that downstream perversion of the illness, which is identification. So I have a primary care doc. Yelda, I'm going to poke at you and Nala and ask, do you both have a primary care physician or like a doctor you see regularly?
Yes, I do. But I only started that habit in the last year or two, I will say, in my mid-20s.
So let me ask you this then. When is the last time that physician offered you a screener, like a PHQ-2, a PHQ-9, or a GAD? So the depression screeners or an anxiety screener. Like, has that ever happened?
So I did, and I feel like maybe I'm an outlier on this, but I was experiencing physiological symptoms, which is why she went ahead and did that for me. And it actually just turned out to be something like low iron deficiency, which I had never had in my life. Wow. And I was like, oh, there's very similar symptoms to what looks like anxiety. And so, I mean, I feel like I was definitely an outlier there. But prior to that, I hadn't really had the need for a screener like that.
So, Nala, I'd love the Canadian perspective as well.
Yeah. From the perspective of someone who studied in Australia and is Canadian, so I'm familiar with being a patient in Canada, not a doctor yet. But in both situations, luckily, I've not seen that doctors are not doing them appropriately. At least, like I'm sure that they could be better. I'm sure there could be more use of screeners and approaching even physical symptoms or physical diagnosis with a mental health sort of lens as well. Not necessarily having to diagnose it, but making sure that you check on that too when you see a patient. It could be better. Anything really could be better, but I find that it's been pretty good. From my experience in Canada, I've been home for about 6 months now, pretty much consecutively. So having left anywhere, I've been home for that long, which is the longest time I've been home in many years. But I did end up getting a family doctor. So to answer your question, this was the first time that I actually have a family doctor that I follow up with, because I've moved around so many times in my life and I was in Australia, so I just haven't been able to consistently see someone. And now that I have one, I went to her for the purpose of making sure I take ownership of my health and have somebody to follow up with me and just see someone regularly at least. And she was really great. She actually did those screeners for me when I first started with her in the practice. So maybe I am an outlier too. I don't know, but from my training, sorry.
No, I was saying, and that was just part of onboarding to that primary?
From my training, I feel like it was something that was really deeply ingrained in our medical training to make sure that we look at everything holistically. And when you have someone come in with a very clearly medical physical illness, to always also look at the mental as well.
Oh, that's fascinating. So
yeah.
I guess, Yelda, thanks for sharing and opening up a bit about what you were going through with your iron deficiency. And Nala, I appreciate the lens from an international perspective. From what I've noticed is like, you'll go to your doctor and you'll say, you're there for, let's say, a cough, like a very acute, episodic issue. And as you're talking to your doctor, you might even say something like, oh man, I've been a little bit sad, right? Yeah. Which rarely happens, but let's say you do. I mean, often he or she's not going to say, all right, let me issue you now a screener for a PHQ-209. They're going to be like, all right, stick your tongue out and let me, run diagnostics. And they have clinical decision support tools that are helping them sort of triage the illness you came in for. It's very sort of cut and dry. And I think that's where, the most opportunity is sort of like at the initiation point to identify or empower people to self-identify. And break that stigma.
Totally.
And the last piece of this I'll say is, right, like we launched health hubs at CVS. And a part of the health hubs was we launched these sort of like wellness studios where seniors would come in and play bingo. And there was this woman that would come in, she came in for like 3-4 weeks straight for bingo night. And what we started realizing is, adult onset loneliness is a real thing as well. And she, until 4 weeks into it, you would ask her every day how you're doing. And she's like, I'm well, everything's great. And then we had this like digital tool we were hanging out to everybody to fill out if they had, it was like a screener for mental health. And in that screener, she was being completely clear to the digital asset that she has like severe depression, really.
Yeah.
And so, and it goes back to this virtual care thing where I think there's an element of people feeling more discreet and able to communicate to a digital asset where to a human, they might feel even uncomfortable saying, I'm not well.
Definitely. Yeah. That's really interesting. I would love to see how that works now, because all of pretty much since I've been home, it's been Corona. So I've only been here for that reason, because everything's been online, whether it's like psychological, psychotherapy, psychiatry, or regular, day-to-day family medicine. How much more valuable that's going to be now, because everything is becoming, through a video chat, or not everything, but a lot of things. So that's exciting. That's cool to hear.
I also wonder about the impact of on individuals and families that live in a lower socioeconomic status, where they might not have a webcam enabled phone or laptop at home, and we're seeing that disconnect as well. I mean, I think here in Houston, just with the launch of online school through the largest school district, HISD, they had some difficulties rolling out and losing track of some of their students, as well as like bilingual students or English as a second language students. And I think sometimes we lose patients and clients that way as well. If this is our only mode of service, we should make that mode of service very simple and available in different languages, and just make it accessible. And I think we're moving towards that direction. So I did want to touch on the subject of as we are living in a COVID world, and Nahla, I think you can speak to this,
Yeah.
as being, kind of homebound now, not being
Yeah.
able, and, having to I'm sorry, I don't know if you had to relocate
No, I can just
because of it all, or it was planned.
yeah, it's pretty typical. I came home just to do an exam. That was the whole plan.
Mm,
In March,
mhm,
I left Australia basically end of February. I was home March 1st, and I did my exam on March 7th. I was
mhm,
meant to do a couple of experience sort of observerships, what they call them, for international
mhm,
medical graduates. So I had a couple of those arranged. I was so excited about them, worked really hard to arrange them, and then everything got canceled.
mhm,
So right
mhm,
after my exam, those were pretty much canceled straight away. And then on March 20th, I believe, right before my flight was actually meant to leave on the 23rd, the borders closed and the flights all got
mhm.
canceled for that entire month, and sort of even a month and a half, they were canceled completely.
Wow.
So I was stuck, and I couldn't even forward plan. I couldn't even think, okay, maybe when a month
Mhm,
opens, like, what am I going to do? Or in 2 months. And
mhm,
I essentially my mental health just plummeted completely. I was not
mm,
doing well at all. I retreated. I was very anxious. I didn't even want to open my emails from work. I couldn't respond to them. I didn't know what I was going to do. There was a new sort of lots of new rules that sort of appearing, where you could apply to go back on compassionate grounds if you were a healthcare professional.
mhm,
That came up about a month and a half into that whole corona situation, so April, May, and I was still in a really bad place, and I couldn't make
mm,
that choice. I couldn't do anything. I was so just paralyzed from it. So I'm still home. I'm still in
mhm,
Canada. I'm very happy with, like, the outcome of things and how things went, because I'm in a better place now. But if
mhm,
I didn't get the support that I needed, if I didn't go see someone, if I didn't talk to someone about it, if I didn't have the family that supported me and my friends, and the active, like, intentional work that I have to do to get through that period, I wouldn't be here now. I would still be really low.
mhm.
Um, so I'm definitely happy to talk about that, to talk
Yeah.
about
Well,
with
I
everything. Yep.
I think it's such a reality for so many. I just think
Yeah,
of, like, recent college grads who spent their
exactly.
senior semester, where they would be job hunting, going to job fairs, and then you have organizations and companies that are no longer hiring.
Yeah,
And you're out there looking for a job from your parents' living room, their dining room table, looking up what
literally.
what positions are available, what can I do next?
Yeah,
And this is their first step into the real world. Or individuals that might have graduated a year out, and then they're, like, laid off. So imagine that, they're new grads, a year of experience, if that, of working in the real world, and then
yeah,
you're basically grounded again, starting from square one.
exactly.
And I think you have to go back to square one to build back up a lot of times.
Yeah,
And I think that time period, you just kind of go through a personal, like, identity crisis, especially if your job is if it's so ingrained with your sense of identity, and
100%. Yeah, yeah.
you go through an identity crisis.
That's literally what I experienced. Like,
Mhm,
to
mhm,
become what I became, which is, I'm still a junior doctor. I'm not, not yet a completely trained physician, but it still meant everything to me. My job meant everything. Like, I had been working towards it for 8 years, 9 years. If
mhm,
you add high school, 10 years, like, all the years that I had put into those applications and put into medical school,
mhm,
it's not my fault, and it's not our fault as
mhm,
a community that we attach so much to, of our value to our jobs and to our careers, because we put in so much into them. We invested everything that we
mhm,
invested into them. So we definitely are going to feel like that's who we are, because
mhm,
we put all these years into it. But I had to, and this is what happened through, going to therapy and having, like, the support that I had and finding the resources that I found to get me through that period of time, is I found so many people were going through that, and that the way they were coping with it was to say, don't tie yourself necessarily to a title or to a name
mhm,
or to an occupation, as much as you should tie yourself to a mission, a goal, what you want to accomplish in the world, what you want to achieve in this world. So
mhm,
you might be able to achieve what you want to achieve. Um, as for me, if I want to be a future psychiatrist and working in sort of a, in forensic psychiatry, whatever that ending goal is, it's,
mhm,
I am not that title. I am not just a psychiatrist. It's that I want to impact people in what way. I need to think about that and reflect internally. What is it that my mission is? What do I want to do with that? And if you attach yourself to a mission, to a more general goal, idea, concept, and what you want to contribute to the world, you take away from that title, and not having that title doesn't make you less valuable. It doesn't make you less valuable. It doesn't make you less of a member of society. For the time being, you're still working towards the same goal. This is just one of the many steps that you're going to take towards that goal. So I tried to reframe all these things and like redefine what I'm experiencing right now, so that I don't feel like I'm, get into that rut where I'm like, I'm not doing anything. I'm not productive. I'm not even like doing a fraction of what I've been doing my, whole life, studying, working, doing all of these things, 12 hours, 14 hours a day. That can like get you into a position where you're like, I'm not accomplishing anything every day. But your inherent value isn't in what you accomplish every day or your productivity every day. You're inherently valuable as you are.
Yeah. And I think when lockdown first hit us all, we were hearing the phrase essential workers left and right.
Yes.
And then I just think of like people that, might have lost their jobs or were considered non-essential, right? So I mean, like, I feel pretty essential, and a lot of people tie their self-worth to that. So what are some things that we can do? I think for you, seeking out support is a great, great first step. And centering really your sense of self-worth. But let's say you are on the job hunt and you aren't working. Well, to kind of get that sense of essential feeling back, like that you are a productive member of society, you can always, offer your skills to volunteer. If you have friends that are also in the same boat as you, looking for jobs or job hunting now in this new situation, is offer your support to them so that, it in turn kind of gives you back that sense of support, that sense of self-worth, and confidence. Even if you're just someone's accountability partner, like, hey, how many jobs have you applied to today? 5, 10?
Yeah, I love that.
Yola, really quick, I wanted to just, in addition to everything we're saying, like underscore how much of an effect unemployment is actually having on the communities that we live in. Like, if we think about it, and I'll use Massachusetts as an example because I'm a Bostonian. In January, the unemployment rate was like 106,000 and some change. Massachusetts workers were unemployed of 2020. Since March, we're at 1.23 million Massachusetts workers who are unemployed. That's a 1,200% increase.
Wow.
Houston, last I checked, was at about 14.8% unemployment, which is almost a historical high, and it's about 12% for those who are recently graduated looking for employment, like college grads. And so if you think about it, in addition to that, about 40% of the population has either lost their job, lost income, or had hours reduced without pay.
Yeah.
Right? And like, now let's tie that to behavioral health, right? About 54% of adults with behavioral health illnesses receive any form of treatment at all. And I mean, I'm pulling stats from the Kaiser Family Foundation for this year. And if we think about it, due to income, due to job loss, due to resource contention, there's now an increase in prevalence and also an increased gap in access for care for individuals facing behavioral health issues. Because those that have become unemployed have lost their benefits more often than not in America, unless they opted in to get COBRA insurance or qualify for Medicaid. And so this is a compounding issue, and one that has severe downstream effects on the total healthcare environment that's going to contribute to both the direct and indirect cost of medical care over time. And so one other stat I wanted to throw up, and I don't want to be the numbers person on this call, but as a result of the pandemic, there's also been a 14% increase in major and minor impact to behavioral health conditions and a spike in substance abuse levels. So, 1 out of 5 people are reporting taking prescription drugs. 1 out of 7 are reporting use of illicit drugs. 1 out of 4 are reporting, binge drinking. And alhamdulillah, those type of things don't affect our community as much, but they're very real, right?
Mm-hmm.
And I think about, that's huge. And it's easy, I think, to say, hey, it's almost, I want to come at this from a place of like not privilege and say, hey, this kind of sucks, maybe go volunteer. I want to really say like, this is huge. And people that are in this situation, like I personally feel for them a lot. And I think as a community, we can do a lot to support each other. And I know ISGH has huge networking programs and
Yeah,
a lot of
they have the ISGH job networking fair that's coming up to support our community.
Yeah. So, I guess with all of that being said, the way I'm looking at it is, there's now tools that are for free, like Headspace, which is a mindfulness app that's opened up to individuals who have been affected by COVID. And so there's, if anyone on the call is interested, it's headspace.com. And, it's for free for an entire year. And I think mindfulness helps a lot as well, in addition to all of the great assets that ISGH has stood up.
Yeah, so I definitely want to touch on individuals that are diagnosed with things like, and children actually, with anxiety, depression, behavioral conditions. Those are all being exacerbated. You're seeing like 7% of children that are diagnosed with ADHD. Well, that percentage is going higher. And those symptoms are showing themselves a little bit differently when it comes to things like distance education and, children that were maybe having one meltdown a week are now having 3 a day. I think that was a recent Time report on that. And also the proximity to COVID. So, if they have a family member that's been affected, you're seeing their symptoms and signs being exacerbated even more so. And it's that kind of that rule of proximity. Like if it's near me, if it's around me, it's going to affect me more. And of course, what's happening between the parents is going to strain what's happening with the children. So you do have parents that have lost their jobs, or one of the parents has lost their job. The stress, any sort of, even marital discourse that is happening in front of the children, it's going to affect their mental health. And I think a lot of times in this country is that our health insurance, our behavioral health insurance, is all tied to our employment, or a lot of people have that kind of tied in, and then you lose that. The child that was, had support, had access to ADHD treatment plans, doctors, and all that, they lose that because their parents lose their jobs, and it is very expensive, I think, to transition to other forms of coverage. Luckily here in Harris County, we have the Harris County Gold Card that actually allows people on a sliding scale, if they're eligible, to receive, health, physical health and mental health access. We also have federally qualified health centers around Houston, like Hope Clinic, Legacy Clinic, and nonprofits like Evansina, where you can be seen. And I do want to touch on the, I do feel sometimes it's kind of, this is kind of hard to say, but, you mentioned substance abuse and how our community is kind of sheltered from it. But unfortunately, just like cases of ADHD or anxiety are going up, cases of substance abuse and illicit drug abuse, we're seeing that go up in our community as well, even though we don't talk about it. So even if it's a small percentage, it's still going up. It's really hard for our community to cope with that. And so take away the access, or you're seeing that even more so. And it's harder to control for a lot of families and individuals. So I do want to touch on that, substance abuse, again, we're blessed to be in a religion where this is something that, you know, we're told explicitly, like, to stay away from, not to do. But unfortunately, it's like anything else, that it does creep into our community and affects a lot of people that we may know.
Definitely. Can I add on to that a little bit?
Yeah, of course, of course.
I was going to talk a little bit about coping mechanisms because, like Uzair mentioned, something like the mindfulness apps, like Headspace. There's also the Calm app. I don't know if you guys have heard of that one. It's really, really good. It has like guided meditation as well. And if you don't have, you know, let's say a smartphone or access to these apps, or, you know, if they do charge you for any reason, YouTube, if you just literally search mindfulness videos or guided meditation, guided mindfulness, there's so many videos on YouTube as well that are free. So I love that point that you mentioned. I wanted to add the other apps as well. But for coping mechanisms that I've had to, not necessarily, like, I'm aware of them and I've done them before, but I've had to do them so much more during this period of time because of all these changes, like we talked about, like to our identity, to our, you know, productivity, to our even like literally physical environment, having to stay home and maybe move back into our families' houses, whatever it is, that we've really had to draw from coping mechanisms a lot more. And one of the unfortunately negative coping mechanisms is substance use. And we can fall back into those traps. Let's say if in the past we have used substances to get through any experiences or stressful periods of our lives. This is the longest running, like, continuous stressful period. Like, we don't even see an end in sight at the moment. So it's very fair that people are resorting back to that type of coping mechanism. Obviously, it's not healthiest, but it, you know, it happens. So it is going up whether you're in a Muslim community or in the greater, you know, general community. But I want to talk about positive ones, if I can hopefully share that with the viewers today, just to give you ideas of what you can do now while you're going through whatever it is you're going through. But the number one thing I would encourage is getting support. So no matter what stage you are in your life, if you are, you know, somebody that can afford therapy or that, you know, has access or means to that, definitely go for it. Try, even if you find that it's not helping you or beneficial to you, I think it's something to try and worth the shot, because we often don't know what's really going on. We might feel anxious or have, you know, symptoms of depression, but have never really talked about it. So it's good to have that space where you feel safe to actually vocalize what you're really feeling. Or if you have a trusted friend, family member, somebody that you trust that you want to sit and talk to, just be like, hey, I really want to talk about how I'm feeling about this. So just find support in the ways that you find that you will be able to trust somebody and open up and share with them. Because we will self-isolate if we are literally physically stuck somewhere. We'll just retreat. That's like a natural response. But trying not to retreat and internalize everything is healthier. Try to let it out in some way. And the other thing we mentioned is relaxation. So meditation, prayer, gratitude, those Calm apps and Headspace apps, going out in nature if you can, if the weather is okay and you're allowed to go outside, and listening to, you know, to just soft, calming music and sounds. Another thing is the physical activity and humor. So two things that we can do is try to make this an opportunity to, like, make light of a stressful situation, even not to dismiss it or to take away from the pain of it all, because it really hurts. And a lot of things we've experienced are painful, are detrimental, are emotionally, physically, financially really detrimental. So it's just to try to look at that from a lens of how do we make light of the environment, the new normal that we have to sort of go through now, and try to make it less overwhelming. And physical activity, which is super important. So if there's any way that you can do yoga at home, you can just buy a yoga mat and do it in your room if you want, or going outside and walking every day, going for like that daily just you time, your alone time, or getting back into a sport that you've done, or going back to, you know, running on the treadmill that's in your basement that you don't use, whatever it is that can get you into a space where you're using your body and moving your body rather than sort of retreating and staying really still all the time, which I did for a long time, and that did not fare well for my mental health until I forced myself and talked myself into going out and being more physically active and feeling better.
And I think the first step to that is accepting your feelings and acknowledging that they're there.
Yeah.
A lot of times we see a denial of that, you know, oh, it's okay, you know, inshallah, it'll all work out.
Yeah.
We hear that very much, like, very often in our community. I think sometimes we just have to sit there and acknowledge the grief that we're feeling, whether it's a person or it's a job. grief is grief. A loss is a loss that we might feel. And I think sometimes even acknowledging negative feelings that we might have. So, with job loss, well, now I'm jealous that other people are working and I'm not. And those are very real feelings that people go through. And, of course, these are discouraged in Islam, but we can't help but feel them sometimes. And again, it's kind of circling back to finding your value of who I am as a person. And if spirituality is something that works for you, that will ground you, lean into that. Whether it's through prayer, dua, I think there's a lot of efforts to do halakas online through Zoom, and just redefining what community is now. Like even something like this, um, you know, it's just kind of the redefining, reframing.
Yeah.
I think these are all great coping mechanisms to employ when you're when you're when you're going through something like this, and a lot of people are right now. And I think again, the following step after that is to seek resources. So it's whether it's your friends, family, your network, your job network, your former job network. Um, Seek those resources, mental health support. At Olive Branch, we offer case management services.
Wow.
So if you need that extra step of assistance, of like, all right, how can I start back from square one and build back up? And we're here to support. Um, we're here to support those first few steps and get people back to feeling their selves, like themselves again.
It's lovely.
Yeah, I appreciate both of you laying out those coping mechanisms and guidance to the audience. And just to tail on that, I think we really sort of laid out the unemployment issue, in North America. We laid out there's this looming upper respiratory illness that is real and causing anxiety and uncertainty for the entire world, right?
Mm-hmm.
A session like this, to me, is a testament um, for our community saying to one another, like, let's talk.
Mm-hmm.
And I think the first step really is like, let's talk about this thing called mental health and behavioral health, and
Mm-hmm.
acknowledge, to your point, Yelda, that, feelings are okay to be had. And in addition to them being okay to be had, they're also okay to chat about and talk about,
Mm-hmm.
and to really seek out folks that, like, I went through a tough time earlier this year. I reached out to my sister,
Mm-hmm.
and she's amazing, and she was really good at being empathetic.
Mm-hmm.
In addition to displaying sympathy, she was really trying to feel what I'm feeling after some really heartfelt conversations. And so, not everybody has, an older sister they can poke at and say, I'm sad. But there are, folks within our community. There's Olive Branch, as you've mentioned. And I'll give some guidance for folks that have health insurance right now. If you're on a commercial plan, meaning through your employer, traditionally you have what's called an EAP, or an employee assistance program.
Mm-hmm.
It's on the back of your card or on the front of it. You can ring them up, and what they do really well is that initial triage and then the coordination piece to get you to the right, most appropriate site of care. Um, in addition to that, there are community groups, and I think we'll send out a list after this call, that are no cost, that folks can really pull on those levers as well. And then the
Mm-hmm.
third piece, I think there's a question here about online resources and videos available. And we'll send out on a holistic list after this call, but there are things like Talkspace. There are, if you're really high acuity and like might be in fear for your life type of thing, there are free resources that are text-based online that you can put on. And then, as we already mentioned, Headspace and Mindfulness, which are low to mid acuity apps, are available as well. And I think I just want to add this as well, as we're sort of in these unprecedented times in the world, but also within healthcare, where the healthcare system is being challenged to treat behavioral health issues at parity with non-BH issues. So that means if I broke my leg today, or I have a mental illness, in the healthcare system, legally, they have to be seen as equally as important, equally as, their medical conditions. And so I think if you do have insurance, pull on it, reimbursement is there. And then if you don't, there's certainly a lot that can happen as well, that we'll be sharing after the call.
Yeah, so I do want to plug just a few local resources. I think since we're talking about organizations like ours, like Olive Branch, we have the Sakina Center here in Houston, again, and just another great organization that offers mental health services with that cultural understanding. And students, I know you're paying tuition to go to online school, but your universities typically have a counseling center that you can utilize, and a lot of them have gone on a telehealth platforms that you can go ahead and, a lot of those are free. I remember being a broke college student, so it's a hard time. Take advantage of the resources that are out there for you. I think there's also another, again, I think this is sometimes an issue with our community. Sometimes we don't see the value in investing in ourselves. So mental health services can cost up to like $250 an hour to see, a counselor, psychiatrist. Mid-range is like 120. Olive Branch and other organizations here in town offer sliding scales. There's another resource called Open Path Collective, I believe. You pay a one-time lifetime fee of $59, and you're given access to a range of counselors in your area that will see you at a discounted rate with a little promo code that you're given. It's like a unique identifier for yourself. And these resources are out there. But again, like I said, sometimes we like to use the excuse of, it is expensive, and finding what's best for you, what's best for your family, what's best for your kids. It's something that we need to treat with, like you said, Uzair, is that a mental health concern should be treated just as much as like a physical, broke my leg, going through depression. You got to treat those things.
And unfortunately, it's just not as protocolized as in like a book, like diabetes might, or a broken leg, because there are, behavioral health is this sort of, it's nebulous in a lot of ways, right? Like, how do you? Not everyone is the same in the way that they're going to find treatment or react to treatment. So that is a bit challenging for the health system. But one thing I will say is, at least in America, there's new legislation and executive orders that have passed for telehealth in terms of cost and reimbursement. In addition to CMS guidelines for 2021 have been amended, and the guidance shows that there's all new CPT codes, a whole new category of CPT codes created for telehealth, virtual, and remote patient monitoring. And so I think, one of the cost, if cost is an issue, from a payment perspective, those things are, I think, much better than they were. And so I just want to plant that seed that, hey, it may seem like taking the first step is costly, but it may not be as costly as you think. I just want to talk about that.
I wish I could share resources, but mine are all locally accessible here in like the Greater Toronto area. But I did want to definitely stress what Yolda said about universities and high schools, and like sort of any facility that you go to, like if it's a college. I think here we distinguish sort of colleges as in like a smaller school, but it's still higher learning, or universities. Wherever you go for your education, there has to be some sort of way to access counseling there, whether it is counseling or it is psychology, psychotherapy. There has to be. So whatever level is available, just look for it. Like, just go online or call your school and say, hey, what's available for me? Are there costs involved? Is this covered in my tuition? And ask those questions and reach out first, because you won't be able to, I guess, We have to think about ourselves as like a vessel. Like if we're going to be drained and empty and just feeling constantly not full and not able to contribute, or I guess like we can only give to the world what overflows from ourselves. We have to look after ourselves first. So you are the main priority. You have to look at yourself as somebody that you love. You look at people around your world and you're like, I love my mom, love my dad, love my siblings, love my partner, whatever it is, but you have to also give that love back to you, because you can't love people well enough if you don't love yourself. You can't contribute to your job or to your school or to the avenues that you contribute to in your life. You can't do that if you don't love yourself and take care of what's going on inside.
So now, like, can I poke at that for a moment? Because I'm sure there's some people really may want a bit more granular detail on the level part as a first step.
Yeah.
Like, let's say there is someone that's depressed or sad, and they are missing that first step of, acknowledging that they have self-worth. What would you say are like easy, tangible ways that they can build that up?
Yeah, I love that question. How do you, I guess, create self-worth? How do you love yourself? We're told that, like, unfortunately, in our community, in our worlds, we're told a lot of that is selfish, like to focus on ourselves and look at our inner world and look after that first. But first of all, I think it's just like throwing away that definition, getting rid of it first, and defining it for yourself. So what does self-worth mean to you? What would it look like for you to feel like you are worthy of your love and your time? That could be giving yourself boundaries. That could be saying, okay, I'm not going to say yes to every single person that needs my time. I'm not going to show up every single time someone asks me to do something, because it's not serving me well. It's actually draining me or doing the opposite. So looking at what does self-worth mean for me, and defining it as not selfish, as a form of actually community building, relationship building. Because if you love yourself and you create that amount of self-worth for yourself, you actually are a better partner, friend, employee, everything. You're better at all these, in all the, I guess, spaces you occupy. You become a better person in those spaces. So look at it, say, I'm not being selfish. I'm actually contributing better to the world when I look at myself and I treat myself the way that I treat people I love. So I'm going to do that for you. So the first step is, I would say, create boundaries for yourself at home, relationship, friendships, workplaces. That's like a whole topic. I don't think I can go into too much detail about how to do that, because it's really a huge topic. But the first thing is, I think we say yes way too much. We give ourselves to opportunities way too much. We don't put down our sort of our line and say, no, this week I actually haven't done anything for myself. I'm not going to just jump on that, that event on Sunday, or I'm not going to write that, article for them, or I'm not going to show up to that non-essential, I guess, not necessary part of my job, like all these extra things that we sign up for. In our families, in our social circles, whatever it is, I'm just going to say no, because I need time for me after myself. So boundaries are huge for self-worth and self-love. And they do make you, people think they wouldn't make you better at, better partners, better friends, but they make you better partners, better friends, and even better family members. Yeah. You can be really toxic if you just give, and don't look after yourself. You can end up being just either toxic for yourself or other people.
Yeah, one of my favorite analogies that's used is kind of that, what do you do in an airplane emergency? You put your oxygen mask first, and then you help those around you, because you really have to feed yourself before you can feed others. And I think that's lost a lot of times in our community, and especially in just looking at my own family, like moms in general. I think they experience this a lot, and it's a lot of cultural pressure that's there for them to do that. They have to, they are super women, but they have to be that. That's their standard. And we see that. We see that a lot.
Yeah. And thinking about the same thing, you're talking about your family, my own family, my siblings, my parents, what they've done for the world, what they've done for their children. But is that what super moms or superhumans should be? Like, is that really what we should expect from people? Like, shouldn't we sort of redefine that first and say, look, it's actually okay to not give your whole entire self to the world and not look after yourself. It's actually okay. Like, that doesn't mean you're selfish. It means you're just you just love yourself, but you also want to love other people in a healthy and balanced way.
You're just a human being.
Yeah. Can we just redefine that, please? Yeah.
Faults and all, shortcomings and all. You're just a human being at the end of the day.
Yeah, I love that. There's a comment in the thread about not being able to go to the gym and staying
Yeah.
at home. In addition to that, I feel like it's, if we think about our communities and our faith is so community based, right?
Mhm.
We just had Ramadan passed, and it was such a unique Ramadan, right? We were missing those intangibles that I think we all had taken for granted, like
Mhm.
giving someone a hug or
Mhm.
praying alongside them and your shoulders touching, type of thing. And I think events like this um, promote engagement. And there's another event that ISGH is hosting on the 26th, and I wanted to do sort of a plug for that. It's a series called Inspire and Innovate, and it's really sort of the mandate for that series is to help folks that are facing turbulence with their careers.
Mhm.
So, be it you're gainfully employed but wanting a change, or you're had a job in oil and gas, and because of COVID, you've become furloughed and need to rebrand or remarket yourself, or you're a recent college grad trying to traverse this uncharted terrain of, the world pre, post, during pandemic, and finding an opportunity. And so it's really about building resilience. It's about
Mhm.
engaging our communities and talking together, and the crux of it is sort of networking as well. And so that's on the 26th of this month, at 6 p.m. Central. And what I love about it is it creates opportunities to connect with people during. We have the director of operations for Peloton. We have a chief strategy officer from the Stagwell Group. So, like, really a world-class panel of folks opening up and talking about it. In addition to like post webinar, a lot of people connect afterwards and
Mhm.
share their information during the call. And um, you know, I was on the last one, and just through that, I got connected with the Shore program at the University of Houston, which is an incubator started by a fascinating woman called Saleha. Like, just, and these are things we used to do in person, right?
Mhm.
So we have to think about, and it's good for our mental health as well, like, how do we engage one another? How
Yeah.
do we stay connected? How do we support one another in this new virtual world?
Yeah.
And this event, and also the one on the 26th, are testaments to ISGH really thinking through that, and creating a platform for us to have, so we can sort of connect, which I think
Mhm.
is incredibly important.
Definitely.
Yeah. I always think about how expansive ISGH's reach is here in Houston. Houston's huge. And you mentioned, Eid. And Nahla, I don't know how you guys do Eid in
Yeah.
Canada, but in Houston, it is a big deal. It is like the Met Gala for us
Oh, it's
when we all come together. And, we're also used to, you know, on a weekly basis going to our local masajids. And when we come together for Eid, usually at a large convention centers, you really just see how large our community is and how big our network is. And I think we've missed that. And I think a reminder our communities is, hey, everyone's still out there. We're still here.
yeah.
And we're going through very similar things. Um, and how can you be a resource to one another? How can you be that branch of support for your neighbor, for your friend that may be going through something, and being the person you might need one day?
I
I
love
think
that.
it's very important.
Love that. That's so true.
I said 6 p.m. It's actually at 3 p.m. I'm
Oh,
so sorry.
yeah. I love that you mentioned that we're all still here. Like the same situation so I live in the Greater Toronto area, which is huge, and the Muslim community is massive. And Ramadan
Mhm.
was something I was excited for and looking forward to so much because I've been away from home for Ramadan for like 5 years. So the first time I'm home for it, it was a pandemic. So it's gutting, it's devastating. It was really hard to go through, completely isolated from the community. But I love what you just said. Like, we're all still here and we're all really going.
Mhm.
Like, we can really support each other right now. So I love that.
Yeah. And I guess just to emphasize, if you're able to be the resource, whether it's monetary donations or just networking people with the right individuals, for mental health access, employment access, case management. These resources are out there. So, if you're listening to us right now and you know someone in need that might not be, tuned in, please share the links. Please share our different organizations and the information that you've learned here.
Definitely.
I think we might be broaching time. So as a parting shot, I do want to say talking helps. It's a very sort of simple solution maybe, and it sounds almost too simple to work, but
Yeah.
talking helps. And, I think that we should continue talking about behavioral health within our communities. I think culturally, I'm Pakistani, and there's been this sort of notion, at least for me growing up, like, whoa, feelings, what are those, right? Just study type of thing.
Yes.
Mm-hmm.
Literally.
It's real, right? And I think the more that we talk about it, the
Yeah.
more we destigmatize it. And we're all going through it. So, keep talking. And I'm really proud of ISGH for hosting something as sort of forward thinking as this. It's really cool.
I don't even know what to add to that. That's brilliant. Like literally that's what I've been trying to advocate for this whole time that I've been home, and just talking about this a little bit more on my social media platforms and with people that I know in my life is, yes, talking does help. People think it doesn't, but it does. So I love that. Keep encouraging that, and hopefully the Muslim community will benefit more and more from doing that.
Yeah. I do want to just throw in a little piece about confidentiality when it comes to mental health access and behavioral health access, and I'll try and keep it short and sweet. But really all, sorry, I should say all providers are, they have to uphold to their code of ethics. So if you're worried about going to a culturally competent counselor who happens to be within your community, I don't want you to think that, anyone that might be listening, that the idea of confidentiality of what you might say, might get out. That just, it can't happen.
Yeah.
We lose our licenses, we lose our practices. Your confidentiality, your trust is our utmost priority when it comes to being a provider. So again, I just kind of want to throw that out there. When individuals are looking for those places, find the support where you need it, and have trust in your provider.
Thank you for saying that, by the way. Thank you. A lot of people have that fear of going to somebody in their community, although they do want someone who is Muslim or from their cultural background, but they're afraid of going to that person because they think they know my family or they know someone I know. So it's literally illegal. You can't share that information. So it's like, thank you for saying that. It's just not going to happen. So if you do want somebody that's going to understand you or that is from your background, that's your preference, and you should definitely, get the type of care that you want. I love that.
All right. So I just want to thank again ISGH for hosting us and allowing us to have this conversation.
Yeah, of course. Do we open it up for Q&A, you think? Or I can't really see if there's folks on, but I'm happy to stick around a bit if there are questions that we can field.
I think there was a comment about prescription medication. Nahla, do you want to address that? I think from your
sure.
kind of the MD background.
Sure. So I guess it just says let's address. So
about
access, I guess, at this point, because if you're not physically going into a clinic or into psychiatry clinic per se, or doing online consultations, with prescription medications here, from what I know, I don't know if this could be applied to the States, but any pharmacy that exists, in the community here, anything can be faxed to them. So you can literally call up the office that you go to. If it's a family doctor or a psychiatry clinic, you call up their office, speak to the secretary or to whoever's in administrative staff is there. Let them know that either you've had an appointment or you needed a prescription. Sometimes you might need an appointment to get the prescription, but just give them a call and say, I need XYZ. And most doctors will actually have in their notes that if they call, you can just immediately fax the prescription because it's a running prescription. So if it's something you've been taking long term, you don't always have to get an appointment. So just call them in, and you'll usually be able to just have them fax it directly to the pharmacy. You can go pick up your medication there.
And what about the stigma associated with using prescription medication to treat behavioral health concerns?
Sure. So with regards to mood disorders and any sort of stabilizing medications, the stigma isn't just in our community. It is literally everywhere. So it's something that I've always faced with patients. If I do notice that they would benefit from it, and I mention it, there's still a stigma in the general community. How do I get rid of that? It's the same thing. The analogies that you've been saying throughout this whole live, I've loved all of them. Like, you don't go to the doctor and have a broken leg and not expect pain medication. You're gonna get pain medication. You've broken your leg. You don't go to a physician and say, and they diagnose you with X condition and don't suggest the treatments for that particular physical condition. So you're given all the options for treatment, whether they're pharmacological or non-pharmacological. There's always going to be a list of things that you can or cannot adhere to. It's up to you. The options are there. The same thing goes for mood disorders and behavioral disorders. Like, there are a list of pharmacological and non-pharmacological options. Generally, when you combine them, you do much better. So your doctor will lay that out for you. You can yourself decide what it is. But if we stop framing them as in mood disorders and behavioral disorders as not as heavy as a physical disorder or physical symptom, when we start to equalize them, we'll look at them the same. Those medications that you need for pain are the same, are equally as important as the ones that you need to stabilize your mood. So I wish I could remove the stigma. I wish I could just get rid of it, but we have to start from each person individually and ask them, well, if you were in pain right now, would you take the medication that I gave you for pain or that I prescribed to you for pain? The answer is almost always yes. So why isn't the answer yes when I offer you a medication for your mental health?
Yeah, and Nala, it's very well said. Part of that is also making sure you identify what's actually going on to find the right treatment.
Oh yeah, of course, yeah.
It's so important, right? Like, I think the root cause of the issue is going to dictate whether you need medication or behavioral therapy. And I think one thing I was just thinking about to myself is sort of like, if we just look at the world for a moment, like, and you ask everybody, like, hey, what do you want, type of thing. Someone may say, hey, I want this job, or I'd love to have this car, and I'm making it up, right? All of these different things. But if you sort of start peeling back the onion a little bit, it's all about happiness, and all of we're chasing sakina. And so, Nala, you pointed this out earlier in the discussion, like, we deserve it, and we should think about our happiness. And if there's something plaguing us, again, finding the resource, identifying the issue, and then treating it appropriately is so important.
I would hope that no one is giving prescription medications for mood disorders without definitely talking to that person, figuring out the root issues, and identifying what all the options are, and having the patient make an informed choice on that, for sure.
And I don't think we have any more questions that I can see.
I think it's I don't see any others.
Yeah.
Great. Again, I'll thank ISGH one more time. And if you know Salma Saeed, who does programming for ISGH, find her, give her a hug. And if you can,
A socially distant hug. Air hugs.
She's been really putting tireless effort around things like this, and just fantastic.
Yeah, thank you for doing this.
Thank you. All right, I guess I think we can say Assalamualaikum and head on out.
Oh, thank